Staying on health matters, a rural farming community, Malabu, in Fufore local government area of Adamawa State, has been thrown into the spotlight. That's following the discovery of a strange disease suspected to be Buruli Ulcer. Health authorities say the outbreak has already claimed lives, with more than 30 persons currently affected. Our correspondent Jesse Daniel tells us more in this report.
Situated in Fufore local government area of Adamawa State, is known for its farming activity. But today, the atmosphere is quiet as some group of residents are seen sitting under the shade, reflecting on the anxiety hanging over the community. The calmness here bleeds the pain some families are enduring as a result of a mysterious disease now suspected to be Buruli Ulcer. Some affected residents narrate how the symptoms begin before it worsens.
Ina feshi a gonan shinkafa haka sai na taka kaya shine sanadi da na zo na cire kayan kuma sai kafan sai ya kumbura da ya kumbura kuma ni ban kawo asibiti sai ina kunci a gida to amma ina kiran doktocin da suke zuwa suna dan wanke mini kafa in fahimta to daga nan kuma abu muna fama da gargajiya ana yi.
A lokacin baya kansar da yana da tsanani sosai, kan yana hana ni bacci kuma yana ciwo ga zafin jiki.
The illness suspected to be Buruli also starts with a small swelling on the skin before it becomes very painful. Community leaders say it spreads quickly because people first try treating it at home.
Duk wanda ya samu wannan ciwo yana gida yana zaune ne yana jinyan kansa. To daga baya ne muka samu rahoto akan cewa akwai wani ciwon da ake dauke da shi a kafa wanda mutane sun dade da wannan ciwon. To shine muka gaya wa hukumomi da suke gaba muka gaya musu abun da muke ciki a wannan.
Authorities says more than 30 persons have been affected and some are currently receiving treatment at the Modibo Adama University Teaching Hospital, with casualties already recorded.
Some came, some did not come to the facility, but they came very late because they had a wrong assumption. Now, finally, to bring them to the facility, they say they don't want injection. So, on our own part, as a responsible and responsive government, we discussed this with the Honorable Commissioner. He presented at the State ESCO. We say, what do you need to do? We say, we must bring them to the facility. I also take good tissue to do histology, a very important test that is available only at the highest level, tertiary center. They've taken the samples, we are waiting results. And all of them, they are not results that you get immediately.
Health authorities are responding to the emergency swiftly. Meanwhile, government authorities are calling for calm while investigation to the disease carry on. JC Daniel, TVC News, Yola.
And joining us now is the Commissioner for Health, Adamawa State, Dr. Felix Tangwami. Good to have you join us, Dr. Felix.
Good evening.
So we understand that we understand that it is not confirmed yet that this is Buruli Ulcer, that another sample has now been taken to the laboratory. What more can you tell us at this moment?
Well, for now, the workers have gone to the field again to ensure that another swab is taken so that it can be taken to the laboratory, like you said. But we have also bought some drugs and taken to the community. Those that are in Modibo Adama University Teaching Hospital are being taken care of. Yesterday, we learned that one of them passed on. You know, this is a skin-breaking suspected ulcer that is eating the flesh. And so when the skin is broken, you are sure that some infections will set in, not only the suspected Buruli Ulcer infection that we are battling with. So today again, they have gone back to the field. Those that are in the primary healthcare facilities are having dressing every day to ensure that they are relieved from pains and also to ensure much more contamination is prevented so that infections will not set in as the skin is broken at the moment. But I can assure you that government is on top of it cumulatively, like it has been said earlier on, and like I said earlier on in this week. This thing started for a very long time, even last year, and these people couldn't bring it to the notice. They were hiding themselves, having a belief that if they take injections, they will die, or it is not something that they will take to the hospital. They are using traditional medicine, and infections, when it became a problem.
Dr. Tangwame, if I may come in, because now you have not been able to identify what this is. You have not been able to identify yet the cause of it. So what sort of enlightenment, or just any sort of, again, enlightenment is going on now in that community to ensure that perhaps this doesn't spread further?
People are being sensitized. They now realize that it is something that they can take to the hospital, because those that have been taken to the hospital are having some relief. Pain has been reduced. They now believe that it is not true that when you take this problem to the hospital, after injection, you will die. It's just a lack of awareness of what they are really passing through. And like I said, also, drugs have been bought. Since it is suspected, we've not actually identified whether it is the Mycobacterium ulcerans, which is the causative microorganism of Buruli ulcer. Broad-spectrum treatment is being administered on those patients before results are returned, so that if the causative organism is isolated and identified, proper treatment that will limit it to the very sensitive causative organism will be administered on the people. But for now, there is no more spread again. It is still in that community, and people don't hold any stigma again, because the health workers are going there, they are enlightening them, and the fear of coming to the hospital is now reduced.
And that's an improvement. Sensitization is very key. Thank you so much for your time. Commissioner for Health, Adamawa State, Dr. Felix Tangwame.
Thank you.